Welcome to the SIBO Doctor Podcast, hosted by Dr Nirala Jacobi. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Head over to thesibodoctor.com and sign up to the SIBO Mastery Program and take your SIBO knowledge to expert level. If you're a patient, you can sign up to the SIBO Success Plan and beat SIBO for good. Please note, this podcast series is not intended to diagnose or treat medical conditions. Ask your doctor before initiating any new treatments. And now, over to Dr. Jacobi and the latest episode of the SIBO Doctor Podcast.
Listen up, practitioners. This one is definitely for you. Welcome to the SIBO Doctor Podcast. I'm your host, Dr. Nirala Jacobi. And today I want to talk to you about what to do when you're doing all the right things in terms of treating SIBO and IBS, but your patient isn't getting any better. And I think all practitioners, and myself included, know what that feels like when you've given the correct protocol to your patient and they come back saying, no, nothing is better. I'm still bloated. I still have brain fog. I still have fatigue. I'm still constipated. And you're just sort of like at a loss as to why this may not have worked. You tested them for SIBO, the test came back positive, you recommended the correct protocol for that pattern, and it just didn't work. What's next? That's the question that I'm frequently asked by practitioners, and I am actually really familiar with this situation because I see such chronically ill patients that it's often not as easy as just treating SIBO. Because if you've learned anything from this podcast over the last 6 years, I hope you understand by now that SIBO is not just about killing the bacteria, because it would be really easy if it was. But SIBO is often a condition within a complex web of contributing factors. I remember pretty strongly or vividly the mistakes I've made with a particular patient many years ago. And this is how we learn as practitioners. We do the best that we think we are doing based on our current knowledge. And when something doesn't work, we're forced to dig deeper until we understand why this didn't work. And so this was the case with this patient who came in with PMS and headaches and bloating that worsened before her cycle, but was pretty chronic, and was bloated all the time, but it did get worse before her period. She also had diarrhea or very loose stool since a few years. And of course, just like any practitioner, I think, oh, this is SIBO and possibly some estrogen dominance issues. And I did a breath test. Sure enough, she had SIBO. And of course, I started with the SIBO treatment protocol, but she never really got on top of her symptoms. She improved a little bit, but the bloating continued. Then I approached it from an estrogen dominance perspective and treated that, and she just wasn't improving. And this just forced me to dig deeper and research and learn about histamine intolerance, and she completely fit the picture. And once I realized this and put her on a low histamine diet and gave her some support for histamine clearance, she just completely turned around and improved and has never looked back. So this is how we learn as practitioners. And I basically had to connect the dots and realize how prevalent histamine issues are among SIBO sufferers. And that's why I'm now much better with histamine intolerance. And this is just an example of one of the contributing factors that we often see in SIBO. And really, my goal over the past 10 years, not just here with the podcast, but also through my education portal, my goal has been to educate as many practitioners as possible about the effective treatment and management of SIBO and IBS. So we know that about 60% of IBS is actually caused by SIBO. That leaves another whopping 40% of other factors or other causes. So my course that I've created and I'm actually relaunching it. I've completely updated and revised it. It's called the SIBO Mastery course. And it's for healthcare professionals, whether you're a naturopathic physician or a nutritionist or an acupuncturist or any of the allied health professions, naturopathic physician, of course, how could I forget you? This course is really something that I have put together in my 25 years of practice, more or less, and just recently have updated it. So fully streamlined this course that will teach you not just about SIBO, but also about other causes of IBS. So I thought today, because I'm relaunching this course and I'm really excited about it, it's probably the best course I've ever created for practitioners because it is fully updated at this point. But what I thought I'd do today is just kind of cover a little bit about some of the areas of or key areas that I cover in this SIBO Mastery course that answers the question, what next? Where to look next when a patient doesn't improve? These 4 key areas are gut wall dynamics, histamine imbalances, gut-brain and brain-gut axis, and genomic influences. And I'll talk about this, each of these key areas a bit more. With gut wall dynamics, we're really talking about the single cell lining plus the mucus layer and the underlying immune system. Together, I would consider that the gut wall. And every layer has a very specific function. And when that gut wall has been damaged, we see a lot of issues around immune activation, food intolerances, food allergies, microbiome imbalances, and this imbalance between mucosal production and degradation. I go into this in great details, of course, in the SIBO Mastery course, but especially when it comes to mucus, I think we don't talk about that enough. There's a very important balance of mucosal degradation by bacteria, as well as the contractile dynamics of the gut that force mucosal turnover. And when there are imbalances with that, if you think about the importance of mucosal protection, for example, that layer of mucus that's 1 layer thick in the small intestine and 2 layers thick in the large intestine, this prevents mucosal invasion. And actually the microbes that are around it, your microbiome, and also SIBO bacteria that are not in direct contact with the mucosa, they diffuse some of the messages and communicate with the immune system below the cell layer. The mucosa is extremely important for protection of and prevention of mucosal invasion, but also as a medium for this diffusing of substances through it. And I see a lot of people that have genomic issues that prevent them from proper mucosal production. I talk about that also in the course, these genomic issues. Once I've started to understand that some people, for example, those that are non-secretors with the FUT2 gene, they really cannot do this healthy mucosal regeneration process as efficiently. And they also tend to have deficiencies specifically in key bacteria, or what we call keystone species, such as Akkermansia and Lactobacillus and Bifidobacterium, that are really key for immune regulation. So when you have that kind of deficit of mucosal production and degradation, you're going to have a slower time with healing. And knowing that as a practitioner, that will give you the tools to explain this to your patient, to not expect them to feel immediately better after a 6-week leaky gut protocol, for example. This might take a lot longer to regrow a healthy microbiome. Next, besides the mucosal issues, when we talk about gut wall dynamics, is also this damage to the microvilli. That the microvilli are the smallest sort of hair-like structures on top of the enterocytes, or the cells that are lining the gut wall. And the microvilli are in the small intestine, and they effectively increase surface area, but this is where also the brush border enzymes are found. And brush border enzymes offer that last step of digestion and absorption. If they're damaged from the gases of SIBO, you can expect much more digestive deficit and continued bloating, for example, or histamine intolerance if those enzymes are damaged. Also, microbiome dysbiosis, of course, contribute to gut wall dynamics, because if you have a very aggressive pathobiont profile that can invade the gut wall, you're going to also end up with leaky gut. And once that occurs, we can expect immune activation and increased inflammation. So really understanding that key area of gut wall dynamics is, I think, a really important key area to consider when your patient is not improving. Next would be really getting very good with histamine imbalances. That is a key area for SIBO and IBS in general. And there are 3 reasons why histamine can be elevated with SIBO. Number 1 would be because we know SIBO causes not just leaky gut, but it causes this mast cell migration into the intestinal wall. And mast cells are parts of the immune system that contain granules of histamine. And when they get triggered, whether that's by endotoxins like LPS from the bacteria that cause SIBO, or because of food reactions, food allergies, or because of stress, because they also have cortisol receptors, then you can experience a lot more histamine reactions because those mast cells are degranulating. But also we see this in SIBO and also in IBS is because of microbial production potentially. Histamine can be upregulated in production by the microbiome. And that's discussed in the histamine intolerance lesson in the Mastery Program. And the third cause of histamine imbalances in SIBO is because the damage to the brush border and the loss of diamine oxidase, which is the enzyme that breaks down histamine. Those 3 are really elaborated in the histamine intolerance lesson in the SIBO Mastery course. I'm a big, not fan, I shouldn't say fan of histamine intolerance, but it was just so revelatory when I understood all of the implications of histamine issues, how high estrogen levels can really trigger and worsen histamine symptoms, for example. This is really important to know if you routinely see women that have PMS, for example. So it has these far-reaching effects. The third key area that I think a practitioner should consider when they ask themselves the question, what is next? I've treated SIBO and the patient isn't any better. Think about the gut-brain and the brain-gut axis. Now, the gut-brain axis is the 2-way biochemical signaling that takes place between the gut and the central nervous system. And the brain-gut axis is where basically the effects of the central nervous system on the gut. So one is the metabolome of the microbes in the gut produce these metabolites, collectively known as metabolome, and it basically travels up the vagus and sends messages to the central nervous system. But the other way is the effect that the brain can have on the gut via limbic system activation or chronic trauma and chronic sympathetic nervous system activation that then leads to the hypothalamic pituitary adrenal axis dysfunction and vagal dysfunction, etc. It's a really dense lesson in the Mastery Program, and I also talk about microbial neurotransmitter production that influences all of this. So very comprehensive lesson there. And then the fourth key area that I think is really important to consider when you're dealing with chronic gut issues and dealing with chronic SIBO patients and potentially not improving or maybe reacting to some of the substances that you're giving them would be the genomic influences and getting really good at looking at which areas or which pathways are really affected in your patient. And this is specifically true for the FUT2 gene that I mentioned before in gut wall dynamics. The FUT2 gene has a gene variant that doesn't allow for not just this mucosal repair, but also B12 absorption. And this leads then into methylation defects. And methylation, it occurs pretty much everywhere in the body where there is DNA repair or rapidly dividing tissues require a lot of methylation cofactors for this rapid cell division that occurs in the gut specifically, because the gut lining repairs itself pretty much every 5 days or so. So it's a very energy intensive process. But methylation has this effect on everything from neurotransmitter production to detoxification to immune issues. I mean, it's just every process in the body to some extent requires methylation. Understanding those SNPs or gene variants can be really helpful. And then, of course, the histamine SNPs, as well as the hydrogen sulfide or the sulfur transsulfuration SNPs that aid in the detoxification of not just sulfur, but really the production of glutathione, and that then leads into the detoxification pathways. So it's a really fascinating area of study that helps with understanding also why sometimes we see more reactions to some supplements that we prescribe, for example. All of this together, these 4 key areas that I look at, of course, require a lot more elaboration. And to some extent, I've talked a lot about all of these topics in the podcast here with my expert guests over the last 6 years. If you want to access this in a much more concise way, then really think about the SIBO Mastery Program. And we have it on sale. Like I said before, my goal really is to promote as many SIBO practitioners as I can and educate as many practitioners as I can, because that means more people are being helped. And that's one of the reasons I also created a Find a SIBO Treating Practitioner database. I've mentioned this before here on the podcast. It's been proven to be an incredible resource. And every day we're getting emails from patients asking for SIBO trained practitioners, and only practitioners that have taken this program are eligible to join this database. So it's a really good practice building tool really for practitioners that are listening, because I'm all about empowering you to be better SIBO practitioners, and I want people to find you. Listing yourself in that database and displaying the SIBO doctor approved button can all be incredible tools that aid in increasing your exposure. There are people that have taken the course previously that have written some really beautiful thank you notes and testimonials. A couple of them I want to share with you because it's been so powerful. Find a SIBO Practitioner database has been really a game changer for some practitioners. Louise, who's a nutritionist in New York, says, I want to thank Nirala for creating a way for people to find a SIBO literate practitioner who has taken the comprehensive SIBO Mastery Program. I would say that at least half of my clients find me via the SIBO Doctor database. I also love the support of support materials such as What Caused My SIBO Questionnaire and the beautifully revised SIBO Biphasic Diet ebook. This is invaluable. Thank you, Louise, for that testimonial. So somebody who's getting half their patients through just being on the database, I think, is pretty powerful as a practice builder. I don't really need to say much more other than understand that it's a really comprehensive field of knowledge, and going really deeply into not just understanding the pathophysiology of SIBO, but all of these other contributing factors, I think makes you a much better practitioner. Also, I go into what you can do about the many of these contributing factors. And I add a lot of naturopathic therapies and hydrotherapies and a lot of treatment suggestions that will just expand your knowledge of not just functional digestive disorders, but really also how to supplement and when to wait. Like sometimes when somebody comes in and says they're not any better, you may actually just need to wait a little longer, specifically around EMO as an example. EMO, or intestinal methanogen overgrowth. We often do a breath test, and if the breath test is quite high throughout the test, this is known as methanogen overgrowth. And if you have somebody that has a gas level of methane of, let's say, 50 or 60 throughout the test, this can take months to really effectively treat to the point where they have regular bowel movements by themselves or on their own. So you may have to supplement with something that keeps them more regular until then. These are the little tips I want to share with you in the Mastery course. I wish you all the best until the next episode of the SIBO Doctor podcast. And I can share with you now that it will be all around sulfur sensitivity. I get a lot of questions to get more information about hydrogen sulfide, and I have a great podcast coming up for you in June about not just sulfur sensitivity, but the whole issue around sulfur and its role in the body in general. It's absolutely fascinating conversation with Dr. Stephanie Senef. To get the SIBO Mastery Program for 25% off, go to thesibodoctor.com.
To access the biphasic diet and the SIBO Success Plan, or if you're a practitioner and would like to become an affiliate, go to thesibodoctor.com. Thank you for listening to the SIBO Doctor podcast. We hope you find the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering. Thanks again for listening.